Good morning, everybody. My name is Mary Donovan, and I'm so happy to see you all here today. Do you want to know how to develop a better rapport with your patients, and in doing so improve the overall quality of care? Liz Bryant, a nurse practitioner, has written a wonderful article titled The Art of Active Listening. In this article, she discusses certain qualities of a good listener: being present for the person talking, being interested in what they are saying, being respectful, and being willing to make the time for them to be able to share their story with us. She talks about several case studies and discusses certain steps that we can make and do to become better active listeners. I am currently an LPN who has learned that the active listening is one of the best gifts that I can give to my patients. It really feels good when my patients actually look forward to having me as their nurse. Today I would like to discuss certain steps with you that are outlined in this article that can help you become better active listeners. Even if you're not going to be in the medical field and just want to enhance the relationship that you have with your family members or friends, this article can help you. First, it is very important for us to create the right environment. That means we need to have a warm, private, quiet room. This will help them relax. It will also enable us to mutually share without interruptions. And talking about interruptions, make sure that we have our cell phones off, computers off, and that we're not sitting here jotting notes down while they're talking. Now that we've created the right environment conducive to active listening, let's take a look at what it means to be present and how we can make ourselves present and interested in what they're saying. Being present and interested means that we are making them the center of our attention. We are going to use friendly body language and eye contact, and we're not going to interrupt them while they're talking. We're going to make time for them to finish telling their story. Did you know that after 18 seconds of being in the doctor's office, that doctor will interrupt the patient? If that doctor allowed that patient a full 2 minutes, the doctor would have a better understanding of what was going on with that patient, and the patient would feel a little bit more in control of the situation. Most of us were not born good listeners. There are special techniques that we can learn and use to become better listeners. I'm going to briefly describe some of these with you. First, we're going to give them good attention. We're going to sit forward, we're not going to have our hands moving, and we're going to continue to make eye contact. We're going to give them the full 2 minutes that the doctor couldn't give them. We're going to focus on what they are saying and not what we are going to say next or what we're going to do next. We're going to create a sense of understanding. We can do this by using certain phrases, such as signal phrases, which is simply, yes, which just kind of furthers along the conversation. Also, we can use emphatic phrases, such as, wow, that had to have been really, really hard. That just kind of makes them know that we're listening to them and feeling what they're feeling as well. Also, we can use reflective phrases. That is my favorite to use with my patients because it allows me to clarify what they're saying by restating what they say. And when I restate what they say, what happens is they say, well, yes, and then they elaborate further. And that's the idea, is for them to clarify or elaborate more in the situation. Timing and silence is also very important. Comments are not always helpful. Sometimes they're actually harmful. Gaps and silence mean very important things because they could mean that they are reflecting on what they're feeling or saying, as well as they might be thinking about it a little bit further and coming up with their own solutions. Silence truly is golden. I cannot emphasize that enough. Also, creating a sense of safety is also very important. That gives them the freedom to be honest without fear of judgment, rejection, or unwanted advice. If we keep that good eye contact and facial expressions while they're doing that, it will reduce anxiety and will reduce their fears. It is really important for us to allow that person to tell their whole story to us. What I would like to do now is share one of many case studies that Liz Bryant shared with us in this article that express why it is imperative that we as professionals learn the art of listening. The case study is pertaining to an elderly lady who was not washing herself daily. The caregivers and the nurses all labeled her confused. The reason why they were labeling her confused was every time that they told the patient it was time to wash up, the patient would say, okay, put the kettle on. Put the kettle on? The caregivers and nurses thought she was crazy, so they labeled her as confused. It wasn't until one day that a nurse actually sat down and listened and talked to this patient further. She found out the most important information was that she used to live by herself and she didn't have hot water in her house. So every time she washed herself, she needed to put a kettle on the stove to warm up water for her baths. So she was not confused. She basically didn't know how to emphasize and be able to tell us what she needed. And by that nurse listening to her, she was able to understand it a lot better, and we were able to tell her what exactly was going on. In conclusion, as you can tell by these articles, when people are allowed to speak with a caring individual who is willing to actively listen to them, not only is a better rapport formed between them, but the overall quality of care and relationship is considerably better. I really hope that you've learned some useful information pertaining to active listening today. It is very important that you realize that you might be that special person that makes a difference in somebody's life simply by providing a safe place, a safe environment, being present, being interested, and making time for them to share their complete story with us. I really want to thank you for listening to my speech today, and I really wish you much success in practicing these new skills that we've talked about today and polish up on the art of active listening. Thank you and have a great day.